evening, everybody, and welcome to the County Public Health Headquarters. My name is Dr. Nick Ephantidis. I serve as the Chief Medical Officer of San Diego County. I am joined by Dr. Wilma Wooten, our Public Health Officer, who will be making some opening comments. I also have joining me Dr. Eric McDonald, the Medical Director of our Epidemiology and Immunization Branch, and also Brett Austin, our Lab Director. After Dr. Wooten makes some introductory comments, the rest of us will be available to answer some of your questions. Dr. Wooten.
Thank you, Dr. Ephantidis. So today, the first presumptive positive case of coronavirus disease or COVID-19 has been identified in San Diego County. The information available to us at this time indicates that the diagnosis is related to overseas travel. So this is a travel-related case. I will not go into details about the case except to say that the case is a female in her 50s. This San Diego County resident is hospitalized and doing well. The case and all exposure details are under investigation. All precautions are being taken to limit the spread of this infection and to protect the public's health. The County of San Diego Public Health Services has initiated the case and contact investigations, which include accounting for potential exposures to the case in the community as well as in the healthcare facility. It is not unexpected that we will have more cases of COVID-19 in San Diego, and we will report those to the public as they are determined. Again, we are reporting this evening the first presumptive positive case of coronavirus disease or COVID-19 identified for San Diego County. Thank you, and we will now take any questions.
Thank you, Dr. Wooten, very much. As we have done before, I will field the questions and pick on you, please. If you could please identify yourselves, ask your question. Know that I will repeat your question and then direct them accordingly. I just want to proactively say ahead of time, we expect that you are going to have several specific questions that we are not going to be in a position to answer tonight. At the point that we continue to get the same questions asked, we will have to keep repeating the same answer. So the floor is open, and who would like to ask a question? Yes, sir. The question is, with regards to the contact investigation, how that is going so far, and do we know if this woman has exposed any other people? I will have Dr. McDonald respond to that question.
Thank you for that question. We do know that there is a household contact, and that person is under self-quarantine. And we do know that there are some healthcare worker exposure contacts, and we're in the process of investigating that further. It appears that there is no general public contact at this time.
Yes, sir. Yeah, the question, thank you, relates to our capacity to elaborate on the nature of travel and where that individual is being currently treated. The only thing we can confirm is that the travel is international, and we are not in a position nor able to confirm where treatment is being received. In the back. The question is, was this person under home quarantine? Dr. McDonald.
No, this person was not under home quarantine, not coming from a location in which that was indicated for an action. Yes, sir.
Yeah, I will have Brett Austin come up and answer that question, but I will also say that we are on the precipice now of beyond just the county laboratory testing capacity, of having very imminently testing capacity in some of our local health system labs, as well as testing capacity in some of the regional commercial labs as well. With regard to the specific numbers, please, Greg.
Thank you for the question. We currently have the ability to provide between 700 and 800 tests for patients, and we're anticipating getting an additional 1,000 tests over the next week from the Centers for Disease Control.
One thing that I want to take advantage of reinforcing is that we are still in the position of wanting to be good stewards of the tests that are available. There is still the request and recommendation that individuals who have concerns consult with their own medical professionals in order to make sure that the test supply that we have is adequate and appropriate for those who need it the most. Next question. Yes, ma'am. Dr. McDonald, if you can share those details, I'll have you answer that question. And if you could repeat it.
Sure. The question was, when was the test performed related to the travel? And it was just a little over 2 weeks.
Yes, sir. Yeah, the question is in regards to this woman not necessarily having gone to one of the well-publicized countries that have been discussed and so forth, and then the question then relates to individuals having concern. Again, to reiterate, there was international travel involved with this case. Our preference would be for individuals who have concerns to contact their own healthcare providers. Again, as a reminder, if there are still individuals in our community who do not have an established healthcare provider, we have an intimate partnership with 211 San Diego. They can call 211 and receive assistance getting connected and coordinated accordingly.
Again, if I could just follow up, this individual actually met our criteria to be tested. That is to say, having fever, respiratory symptoms, and was admitted to the hospital. And so I think that's an important distinction that needs to be communicated. This person was sick enough to be in the hospital and then met our criteria for this testing.
Other than what Dr. Wooten said in the opening statement, that is it. And again, there is, in addition, thank you, Dr. McDonald, to the symptoms that were mentioned, the history of international travel. Yes, ma'am. I'll let you handle that. The question is, can you please tell us what part of the county the individual lives in, and why are we reluctant to share what part of the world she traveled in?
Well, we are working on the travel question with our partners in the CDC quarantine office, and we think that we need to let that process go out before we reveal any details about the travel. So I just ask you to be patient on that.
And as far as the part of the county, again, related to patient confidentiality and an ongoing investigation, those details are not currently available. Yes, sir. Thank you. The question, if I may restate it, relates to the time frame with regard to the travel, and then timing of the test as it relates to the current general guidance that we've been talking about with regard to the incubation period. Dr. McDonald.
No, we are not concerned about the current CDC guidance about the incubation period. for this. Again, the test occurred after the 14 days of travel, but again, the test occurred after the person had been admitted to the hospital with symptoms. Sure. Their question that had to do with concerns about the current quarantine. Again, we follow and support the CDC's guidance on quarantines and precautions that should be taken after travel.
Yes, ma'am. The question relates to any reason for concern with regard to exposure to the general public and any potential concerns with regard to exposures other than a person at home. As was already stated, our contact investigation process, which is very robust, is still very much underway based on the timing and potential exposures. There is some contact tracing underway with regard to healthcare workers. As far as the general community, we, at this point, do not have those concerns. Paul. So the question relates to developing, as is often the case in situations like the ones we are facing, guidance from the CDC with regard to quarantine recommendations that are a little bit more broader in terms of recent travel exposure. I will have Dr. Wilma Wooten answer that question.
Thank you for that question. In addition to travelers from China, we are now receiving names of individuals that are traveling from Iran. We have not yet begun to get names of people that are traveling from South Korea or Italy or Japan. So we will continue to follow CDC's recommendations. Does that answer your question, Paul? Okay.
Yes, ma'am. Question without repeating the y'alls relates to the current practice happening at the airports and the rest of our approach as it relates to further investigating cases like this. Dr. McDonald.
Sure. Again, really a question like that about current screening procedures and the types of questions that are asked when people return from international travel is really best gone to CDC and Department of Homeland Security. I mean, I think that we do support their current efforts, and it has evolved. And I think I'd just like to make 2 points. Another change that happened today is the type of samples that can be collected from patients. Instead of having separate nasopharyngeal and oropharyngeal specimens, they can actually be combined together. And it's just a small example, maybe not as relevant to everybody here, not the general public, but a small example of how there is constantly evolving guidance and refined guidance as new information and new science comes in. And as we learn about new locations, we may have different strategies for screening. But I think another important message that the public needs to get is that this is the general public has no change in their very low risk here in San Diego, because this is clearly a travel-related case.
Thank you, Dr. McDonald. I really appreciate it. Yes? Go ahead. The question relates with regard to our desired takeaway. As I discussed during the last press event, I think that there is a balance to be struck and a needle to be thread between our community being prepared, being informed, and being judicious, and being educated, versus reacting inappropriately or having a sense of either panic or disproportionate concern. The case that we are talking about here very clearly fits criteria that put it into a travel-related case in the context of the symptoms that Dr. McDonald mentioned. We do not have any evidence, nor do we believe, that this is a community-acquired case where individuals potentially develop symptoms and raise suspicion without there being any travel history, without there being any high risk or known exposures. So I think our community would do well to know that we've got this. This is completely expected. You have heard of the number of individuals and the process by which we are monitoring folks. As was stated, and I will repeat, this was an international travel that did not fit into one of those specified areas, but it is a travel-related case, and it is not a community-acquired one. Ma'am, I'm going to make yours the second to last question, and I'll take one more, and then we'll be done. Yeah, and that is an excellent question and a very good question, and it relates to at what point in time should people be thinking about the potential of getting tested, and some compare and contrast with regard to the COVID challenges versus the typical presentation of the flu and influenza. I'll have Dr. Wooten respond to that, please.
When you talk about the cold typically does not have fever. So we would kind of cast that aside. But with cold illnesses, you have runny nose, sneezing, you could have sore throat, and you could even have a cough. But typically there's no fever associated with that. With COVID-19, the three hallmark symptoms are fever, cough, and difficulty breathing or respiratory distress. And again, that the respiratory distress is the feature that drove the healthcare providers where the woman was being seen to ask for the COVID-19 test. It is really essentially difficult to tell between COVID-19 and influenza. The symptoms are very similar. So that's why we have to look at the risk factors associated, looking at if there is any travel, any association to someone who's a confirmed who has a confirmed test or has traveled. And again, if neither of those two risk factors are associated, then if the individual presents with respiratory distress, again, providers should think about ordering a COVID-19 test.
And again, I also want to emphasize and repeat, folks, we are still in the midst of the influenza season. We still have documented influenza cases happening in our community. Besides influenza, there are a host of other upper respiratory viruses that folks are dealing with as well. So to just reinforce Dr. Wooten's point, especially in the context of us not having established community-based transmission yet, that is why the evaluation, the consultation in terms of whether or not somebody needs testing and to be able to be educated in terms of their concerns really are best handled in the context of an established relationship with their own provider. And I'll make this the last question. Yes, ma'am. The question is if this individual traveled through San Diego, Lindbergh Field, and if so, when? We do not have that detail at this point. And I will also say, folks, in concern, in transparency and passion to do everything that we can for our community, we literally are before you today very quickly after having received this first presumptive positive case. There will be additional details forthcoming, and as is our commitment and as is our pattern, we will keep you all informed. Thank you so much for being here this evening, and thank you for your participation and education of our community. Good night.